Huh. Well, you remember this, right? It's been a crazy 24 hours, and Enloe Health has now made a public statement about Miss Michelea Ponce. Let's check it out and let's see what this guy is. I don't know if he's the CEO or whoever. Maybe he's the spokesman, but let's just see what he has to say about this. And my question is she getting fired? Let's go.
Enloe Health acknowledges that the off-hours behavior by a medical assistant employed in one of our outpatient clinics, as depicted in a recent social media post, was abhorrent and deeply concerning for our caregivers, our organization, and our community. The target employee who was verbally accosted in this post deserves significant credit for handling the situation in a calm and collected manner.
The target lady, bless her heart, Jeannie, who was being harassed by Miss Michelea Ponce for wearing the red t-shirt. Just in case you haven't seen it, let's go.
We appreciate the many individuals who have seen this post and exercised restraint as they voice their personal views regarding this situation. Unfortunately, many thousands of others have chosen to use profanity-laced language to express their disapproval to Enloe caregivers.
Heck yeah, they mad. This girl was crazy, of course. They're angry. Sometimes when we get mad, we just cuss. You know, you wake up, you say F word or something. I don't know. Come on, let's keep going. But they're mad. They're mad.
Apart from being unfair to our staff, these comments have overwhelmed our phone systems, impeding our ability to serve patients and their families. Rest assured, the behavior depicted in this video does not mirror Enloe Health's core values, and we are committed to doing what is right by taking the actions necessary to protect our patients and community.
Now, y'all just heard that, what he said. And I know a lot of you are probably thinking, well, all we want to hear is she fired yet? Let's see.
At this time, we ask for patience, grace, and civility as we do so. As part of our policy and commitment to confidentiality, Enloe Health does not provide comments or statements regarding individual employees or personnel matters. However, comments can be shared directly through a dedicated phone messaging system. That number is 530-332-9818, or using email share@enloe.org. That's share@enloe.org. For the safety and convenience of our patients, we ask that commentators refrain from calling our main switchboard, staff, or clinic offices.
Yeah, I respect that. He doesn't want anybody to call just harassing the main switchboards, because you do have friends and family who are at this hospital at the time, and they are, they're checking on their family members. We get it. But Enloe Health, here's the question. Are you going to fire her? Is she going to be accountable? Is she going to be put on probation? Is this a one-off for her? But from what I've heard, she's already has harassing charges against her. Now, I'm not going to display her criminal record on display here, because I have it, but I don't want to do that because, that's like it could be public information, but I don't want to be, I got to do house cleaning. I want to make sure it ain't coming back at me because I'm just the messenger. However, if she has harassed people in the past and she solely hates everything that the president and all of them, she's very vocal when it comes to her political views. And if she takes that to the street, literally inside of and I'm gonna keep saying this, to people's employment, and harass them because they don't like what she's wearing or she doesn't like what they're wearing, come on, babe, you can't do that. That is not right. It doesn't work like that. And cuss them out, call them a POS because she's wearing the shirt. I don't know. The great thing about this, little old Jenny she's got a GoFundMe, and I think Benny Johnson or somebody set this up for her, and they've already raised like close to 90 to like 100,000. I think I've seen. And then the next goal is to retire this poor lady. Bless their heart. I think that's a great thing. But Michelea needs to pay the price for that. She needs to be on probation, fired, out, nice nurses license revoked, something. She needs to be fired. I don't care. I'm sorry. She needs to be fired. But real quick, before we go to that fire scene, this is, well, I'm about to share some news with you. I don't know if it's true. I see these posts all the time, but it could be true. But this is a picture of her husband and her daughter standing in the back of a car with the Carly Church sign. You know how they do that neck thing? This is ridiculous. And he's an umpire for kids, and that's her husband. Supposedly, allegedly, that's her husband. But one thing I want to share with you right now is I just saw a post right here that it says that she was actually fired. So we will see. Hopefully they are cleaning house. They're doing their due diligence here and doing the right thing, because I think she should be done. I mean, healthcare workers cannot go around and do this. It's not good. I'll stick to my guns on that. It's no good. She should be fired. And I hope this post is real, because from listening to what the spokesman just said and what we're seeing here now, you know, Twitter, man, these people are all around the world on Twitter, man, and they get in people's business. This might be true. What's your thoughts on this? If she's fired, it's justified. You ain't got to say yes or no. I know it. It's justified. Hope you guys have a great day. Thank you for all your comments, all your love. If you have not subscribed to my channel, please subscribe to my channel. I am trying to get to 1 million subs. It's the way to go, baby. And I thank you for being here. I hope you guys have a fabulous week. Be safe out there. And I don't think there's going to be any more updates on this. We'll see. There might be, because it's been a crazy 24 hours. Have a great day, guys. Talk to you soon.